Managing change in healthcare. Change is everywhere, and particularly prominent in healthcare across the complete continuum of care. Hospitals, surgi-centers, nursing homes, rehabilitation facilities, outpatient centers, physicians, and other professional health providers have all experienced this on a regular basis. Fiscal regulations change in one setting, putting pressures on it until the leaders, quote, figure it out. In the meantime, changes begin in other sectors of the continuum, putting increased pressures there. PPS, DRG, HMO, population capitation and management, and medical homes are just some of the fiscal changes that have been imposed upon most all settings in the continuum of care. At the same time, there are dramatic changes in the provision of health care. These include new drugs, new protocols, and new technology. Engineering, biology, and research are adding to, overlapping, overlaying, and in some cases, putting the provision of care on its head. The explosion in capabilities of information technology is not only changing the documentation, but also the provision of health care. According to an article in MedPage Today, the top 10 changes that impacted healthcare provision in the first 10 years of the century are: human genome discoveries reach the bedside, doctors and patients harness information technology, anti-smoking laws and campaigns reduce public speaking, heart disease deaths drop by 40%, stem cell research, laboratory breakthroughs and some clinical advances, targeted therapies for cancer expand with new drugs, combination drug therapy extends HIV survival, minimally invasive and robotic techniques revolutionize surgery, and study finds heart and cancer risk with hormone replacement therapy, and scientists peer into the mind with functional MRIs. These changes not only impact how we deliver care, but where, when, and under what circumstances. At the same time, as in every workplace, the needs of the employees are changing. We have at least 3 generations in the workplace, and their demands are not only different, but evolving. With all the change around, how can you manage it well? According to Strategy and Business, the capabilities needed to manage change include the ability to understand and address the human side and to do that systematically. Any significant transformation creates, quote, people issues. Jobs change, new skills and capabilities must be developed, and employees are uncertain. Start at the top. The leaders must stand strongly together in understanding the ongoing changes and be able to clearly articulate them. Involve and consider every layer of the organization and how the changes impact them. Make the formal case. Although people commit emotionally, you still must make the formal and rational case. Create ownership at every possibility. Buy-in will help keep things moving along. Communicate the message. Others do not understand the issues, feel the need to change, or see the new direction as clearly as you do. Assess the culture and readiness for change. Leaders must know how fast and how hard they can push their culture. Address culture explicitly. Be explicit about the culture and underlying behaviors that will best support the new way of doing business, and find opportunities to model and reward those behaviors. Prepare for the unexpected. People are still human and will react. The same goes for competitors and partners. And finally, speak to the individual. Each person is an opportunity to improve the change and support it. Change is not a one-time event in healthcare. It is imperative that leaders keep these principles in mind all of the time. Great leaders are consistently interested in improving their skills in communications, assessing, planning, and developing strategies. As a leader in the healthcare industry, take advantage of the opportunity to determine your level of skill in assessing the environment and people, designing a plan to move forward, and driving a great plan with the support of the organization. To support you in this, we offer you the opportunity to take the assessment that we most often recommend to others in the healthcare continuum. This will allow you to measure your capacities relative to strategy, communication, decision-making, and implementation. We have used many of them and believe that this one is particularly relevant to organizations in determining their assets leading in a rapidly changing environment. If you're a company leader and are interested in the behaviors that will help you support your company's